Hello, this is Dr. Suzanne McNeil from Crown Point Optometry. Today we're going to discuss contact lenses. I frequently get questions about contact lenses in my practice, so here I am to demystify some of the most common ones. So the first question that I often get asked is what's the difference between different brands of contact lenses and why people should not switch contact lenses on their own. So every brand of contact lens has its own distinctive material it's made out of. And so certain materials are more comfortable for certain people than others. Certain ones are easier to handle than others. And more importantly, certain ones fit better on the eye for certain people than others. Also, there's different sizes and shapes to the different contact lenses, which can make one contact lens both more comfortable and safer for one person than another. So for those reasons, you don't want to be switching contact lenses on your own because you could very well be compromising both your comfort and the safety. Also, there's certain contact lenses that correct astigmatism. Those ones in particular can be a little bit more finicky because they need to be stabilized on the eye to prevent rotation. So those ones in particular, you're going to want to be using only the brand that's been checked for you for best results. Along similar lines to the previous question, I also get asked, which are better, dailies or monthlies? So that's the thing, dailies are the new kind of standard of care when possible just because you eliminate quite a few risks. You eliminate the risks of contaminated contact lens cases, you eliminate the problems of proteins building up, you minimize the fuss, and also so therefore you're minimizing the risk of infection. However, there are certain specialty lenses that are only offered in monthlies, so for some people, monthlies are the only option. And for those people, as long as they care for their lenses carefully, they can do very well. Another question I get asked is, are all contact lens solutions the same? What are the differences? For soft contact lenses, there are two major categories of solution. The first are multi-purpose solutions. A multi-purpose solution is one that you can both rinse your lenses in as well as storing them in overnight. The advantage of this is that it's a little bit more convenient because you only need to have one bottle. The other category of solution is a hydrogen peroxide-based solution. Now, hydrogen peroxide, as you may know, can kind of burn if you put it on a cut. So in a similar way, it can burn when put directly in the eyes. Therefore, it can be used for cleaning the contact lenses, but can't be used to rinse them out before putting them in. So you need to use a separate saline solution for that. The advantage of the contact lens solutions with hydrogen peroxide, though, is that you don't need to have any preservatives in it because the hydrogen peroxide itself does the job very nicely of killing any bacteria. Another question that I get asked is, why does each bottle of contact lens solution come with a new case? This one's fairly simple. The reason why they do is because contact lens cases are designed to be replaced from time to time, and so by replacing your case every time you get a new bottle of solution, you know that you're not going to give bacteria or any amoebas or any other microorganisms the chance to grow on your contact lens case, causing the potential for eye infections. People also want to know about whether or not it's safe to wear contact lenses in certain situations, like swimming, showering, or even scuba diving. The answer to these questions in the case of swimming is that ideally you want to be using daily lenses if you are going to go swimming and throw out the daily lens after each time you go swimming. For people who go swimming much more frequently, you're better off getting prescription swim goggles. In the case of showering, the answer is no, you don't want to wear your contact lenses at all when you shower. The reason being, even though your tap water is clean enough for drinking, there can be certain amoebas and other microorganisms that can be in the tap water that you don't want to get held onto your eye by the contact lens. In the case of scuba diving, it's similar to the case of swimming in as much as you want to be using daily lenses that you throw out after. And if you're a regular scuba diver, you can also get scuba masks that do have a prescription built right into them. Another question about contact lenses is, when should I see my optometrist about contact lens problems? The general guideline is, if your eyes are red, uncomfortable, or you've noticed changes to your vision, it's time to see your optometrist, unless those symptoms are only very fleeting and go away completely when you remove your contact lenses and don't return. Anything more than very, very short-term difficulties like that, you want to go back to your optometrist right away to rule out any infections that may need antibiotics. Another question I'm asked frequently is about people who need bifocals and whether or not they can still wear contact lenses. The good news is contact lenses designed for people who need bifocals are getting better and better each year, so there's more and more options available. So the good news is the majority of people, especially those who were successful at wearing contact lenses before they needed bifocals, the good news is the vast majority of those people will be successful in bifocal contact lenses also. Are there certain people who are not good candidates for contact lenses? There's a couple different reasons why somebody might not be a good candidate for contact lenses. One category of reasons are health reasons relating to either the person or the eye. In terms of the eye, if somebody has very severe dry eyes, for example, soft contact lenses would tend to be very irritating for them, and they would be unlikely to tolerate having them in their eye very well. So those people would generally not be good candidates. In terms of health, people with chronic medical conditions like diabetes and high blood pressure, if the condition is not well under control, those people would also not be good candidates for contact lenses. Another category of people are people who would have difficulty with the care and also putting the lenses in and out. So these would be people who have trouble with fine motor skills. For example, maybe somebody with Parkinson's or other reasons why they would have trouble with their coordination. I'm also frequently asked, what is the minimum age for wearing contact lenses? So there's all sorts of reasons why a child might need to wear contact lenses. For example, somebody with a higher prescription who participates in certain sports activities or acting, or medical reasons why a young child may need to be in contact lenses. So as long as the parent is motivated and is willing to do the work to take care of the contact lenses, there is no minimum age. People, including infants, have successfully worn contact lenses. However, for children to be independent with the lenses, generally 10 years old is the minimum age to be responsible for daily contact lenses, and about 13 or so for monthly lenses, just because they require a little bit more care. Below that age, parents can expect to be supervising and doing a fair bit of the work themselves. The last question we'll go over today is, what are the risks of wearing contact lenses and what increases the risk? So the main risk of wearing contact lenses is infection, because the fact that you're manipulating something and putting it in and out of your eyes, there's always the risk of a bacteria, amoeba, or virus hitching a ride on your lens and getting in your eye at the same time. The good news is this risk is very low, and there's lots of things that you can do to help lower the risk. So poor hygiene is essentially behind a lot of the risk factors with contact lenses. So that means not washing your hands properly before putting your lenses in or out, not replacing your lenses on schedule, not cleaning and replacing your contact lens case on schedule, things like that. Another bad habit, which increases the risk of infection by about 5 times, is sleeping in your contact lenses. So unfortunately, even naps increases the risk, so ideally people should be avoiding this practice. So that's all for today. Thank you for watching the video, and please stay tuned for more videos from Crown Point Optometry.